位讲者 Lorraine 蔡乐英将带我们走进他和医学的故事，探讨他对医学伦理的理解。
Hi everyone, I'm Lorraine. The talk I will present today is called From Medicure to Ethicure. I know it sounds a bit confusing, but I promise it will be a day-to-day talk. So what about starting with a little survey? Is anyone here afraid of hospitals? Please raise your hand. Okay, I have to admit that I am afraid of hospitals, and I can see approximately 50% of you raise your hand. So what about taking a look at this picture? Is anyone afraid of this picture? If you feel a little bit pain in your arm when you see this picture, please raise your hand. Okay, I can see plenty of you. And what about this one? Does anyone know about this one? Yes, so if you go to the dentist very often, you will be afraid of this. It will be your nightmare. So there is actually a long term for these kinds of feelings called nosocomophobia, meaning the fear of doctors and hospitals. And it is actually pretty common. 1 in 3 people in the US has nosocomophobia, and interestingly, 1 in 10 develops this condition because of unpleasant or even traumatic experience in the hospital. So they are afraid of the embarrassment and pain. Well, this is very problematic since people avoid seeking for medical help, and they eventually become very sick and even die only because they are emotionally resistant to the treatment. But today we are here not talking about psychology. So let me just go back to explain the terms I used earlier. These terms are actually quoted from the famous TV show, The Good Doctor. So Medicure is a word combining medicine and cure. And it is pretty straightforward that we not only use medicine, but also thousands of kinds of surgeries and therapies to try to cure a disease. And we have made a lot of progress in biomedical science that we found at least relief or treatments to almost every kind of disease existing, which is a great news and what we get used to. On the other hand, Ethicure is a word combining ethics and cure. Although I know there's a course in medical school called medical ethics, I have seen a little research done in this field. So today, instead of talking about how the treatment process meets the moral code, I would like us to find about what is the ultimate purpose of medicine. So I will use 3 chapters and 4 examples to kind of dig into my observations in daily life. The first question I would like to discuss about is called treat it or not. Does anyone here have allergic rhinitis, which means 过敏性鼻炎, or asthma, which means 哮喘? Please raise your hand. Okay, that's impressive. And I do have allergic rhinitis, and if you do, you might be familiar with this one. So when I went to see the doctor at the age of 13, the doctor recommended me something called the allergy shots, which means 脱敏针. And this is how it works. The doctor gives you injections of your allergen with increasing dosage until your body develops tolerance to that allergen. So you are basically cured because you are not allergic to that allergen anymore. Sounds very great, right? But the problem is, these injections are given 1 to 3 times per week, and it triggers allergic responses like runny nose and rash, just like the symptoms of your allergic rhinitis and your asthma. Along with being stabbed by a needle several times a week, it was at least bothering or even painful for the patients. And don't mention that this treatment lasts for 5 years. Plus, it is pretty expensive, costing from 20,000 to 40,000 yuan per treatment. So when I was firstly introduced to this treatment, I was freaked out. But it seems like almost every patient coming out of that clinic was holding the allergy shots brochure which means the doctor recommended it to almost every patient, no matter their allergen or the severity of symptoms. Of course, I appreciate the effectiveness of the allergy shots to patients with severe allergy issues. But the problem is, mild allergies can be easily managed by taking oral antihistamines or simply avoiding contact with the allergen. Is it really worth it to prescribe such bothering treatment to the patient? Will the overall life quality of the patient decrease because of this treatment? I think this is what medical workers and doctors should really consider. And as probable patients, when we are considering accepting or declining a treatment, we should really take our feelings into consideration because we don't want ourselves to suffer more, do we? And this leads us to the question, why do we need healthcare? Healthcare, according to Wikipedia, is the maintenance and improvement of health. But why health? Health is not just ranking at the list of 10 things a most successful person should have. We need health because we want to be as happy as we can in our limited lifespan. And we don't meet some criteria of being perfectly healthy because that's not possible. We either inherit some defects from our parents or acquire diseases from our inevitable lifestyle. So these imperfections made us individuals. And this draws us to a conclusion. That we don't have to treat any disease we have or live a strict life at the cost of compromising the happiness we feel. Because none of this criteria matters when we leave the world if we are not pleased with our life. So what about switching to a more life-relevant topic, tolerance? Does anyone here experience headaches, high fever, menstrual pains, and your parents or family members stop you from taking painkillers and ask you to tolerate it? Please raise your hand. Okay, I can see a few. That sounds very typical parents, right? In fact, the painkillers available in the market are well proven to be fast, effective, safe, and have no dependence while used properly. And this message has been delivered to the public. But there's still a majority of people who refuse to take painkillers when necessary. If you think that it's a small issue, then look at this one. Upper endoscopy is something you're not going to avoid in your lifetime during a body check. Since there's a tube going through all along your mouth, your throat, your esophagus, and then your stomach, you will feel extreme nausea and probably pain. And some patients report that they will never try to experience that again. And this is why gastric cancer is always discovered in late stages in China. The good news is, upper endoscopy with anesthesia was first conducted in 2005 in China. The patients were unconscious. And then the bad news is that until 2017, less than 10% of cases in China is with anesthesia, which means 90% of people are still using the painful way. And another famous example is called painless labor. The labor process is well known as a terrifically painful process. And thanks to science, a technique involving injecting anesthesia into your spinal cord can reduce pain from 60% to 100%. And first painless labor conducted in China was in the 1970s. And then the bad news, unfortunately, is that until 2022, only 30% of mothers underwent painless labor. And what has been going wrong here? With all due respect, I am putting my guess here. Is it because we are educated that endurance is a kind of virtue? We were all taught not to bother others, but we ignored how we feel, which should be the first in place. In fact, we need pain management not only because we need ourselves to feel better, but also because pain can bring physical health issues, which we call complications. Pain can raise your blood pressure, your heart rate, and if a patient struggles in an invasive examination like upper endoscopy, it is likely to cause trauma to her or his internal organs. And if the mother suffers from pain labor for too long, the acid accumulated in her body will poison the baby. And the most important thing is that anesthesia in the market is well proven to be very, very safe. So there's no benefit for endurance. In the last part of the talk, I would like to present you with a case. So everyone in this room will be a decision maker who is deciding a person's fate. And our case is, there is a 76-year-old male who's unconscious, and a possible cause is hepatic artery bleeding. So now we have two options. Option one, we do an angiography to try to find out the bleeding, which means taking a photograph of your vessels. If there is one bleeding point, we try to fix it, and then the patient has a small chance of waking up. And then we have option B. We try to maintain the vitals as long as we can, but we are not going to put in any treatment. And we enter the end-of-life process, caring process, and we try to let our patient suffer less. Now, it's your time to pick an option. If you go with option A, please raise your hand. Okay, I can see probably 60%. And if you go with option B, please raise your hand. Okay, it's a tough call, right? And when I encountered this question at the age of 13, I immediately jumped to option A, because this patient was my grandfather. And I think there's nothing more important than he was alive. But this was my mom's call, and she chose B. She told me something I will bear in mind in the rest of my life. She said that there's no way an elderly can recover back to normal after undergoing such surgeries. And yes, there is a possibility that he might wake up, but he would never enjoy the food as before, travel as before, or simply getting out of bed. It will be miserable for him to try to take care of himself in the rest of his life. So why not we just let him go in peace and grace? Because this day eventually comes, just a matter of how. Indeed, my mom taught me the first lesson in medical ethics. And of course, I really respect and appreciate every choice you make, because there's no absolute right or wrong in this question. And I know that the topic we've discussed is very controversial or ideal. And I'm clearly aware of the problem we are facing. Shortage of medical workers, shortage of finance, and insufficient knowledge of the patients. But this is a change that is going to solve the problem of nosocomophobia, avoidance of hospitals, and getting back to the origin of healthcare. And the question is, how can we initiate a change without realizing it? Before we end, I would like you to show the greatest respect and gratitude to my grandfather, who has incredible wisdom and taught us this vital lesson. Please give him some applause. And this is the end of my speech. Thank you for listening.